Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. I'm sure many of you are aware that majority of the household products lying around your house are poisonous, like bleach, laundry detergent. But what are the symptoms? And what do you do if a child or an adult ingests them? To tell us more on this topic is ExpressCare's Dr. Jitka Lom. Welcome, Doc.
Hi, Jolene.
All right. So, of course, I have kids and, and cleaning products. So, it's always little kids, they love to just stick things in their mouth, whether it be, a bottle of bleach or whatever. So, it is a big scare for a lot of parents to see your child accidentally pick up, a cleaning detergent. So can you tell us, what are the first steps when finding out someone has swallowed something poisonous?
Yeah. Well, I think the first step is to take a big breath and not freak out, because the typical thing is, like you said, you come home and you see the 2-year-old with half a bottle of Windex and half of it's on the floor and there's blue on their mouth, and you don't know how much they've ingested. So the first thing is to take a deep breath and then pick up the phone and call the National Poison Center, which the phone number will tell you several times on the show today, but it's 1-800-222-1222. Okay, and that number, somebody is there 24/7 to pick it up, and most accidental poisonings can be handled at home. Of course, if you find your child is unresponsive, you immediately need to go to the hospital. But if your child is sitting there talking to you, breathing and all of that, then the first thing you need to do is call the Poison Control Center. And what they will do is they'll ask you some questions about how big is your child, how much does he weigh, and how much was in the bottle that you remember before this all happened, and then how much do you think is on the floor. And they can also tell you what the active ingredients are and help you treat this at home.
Okay, now what are some of the symptoms that a parent can look out for to tell whether or not their child actually ingested poison?
Yeah, if it's a liquid poison like a detergent, dishwasher detergent or something like that, laundry soap, then the symptoms will tend to be vomiting. Sometimes if it's depending on the toxin, you can get a fever. Of course, there may be changes in the mental status, meaning the child is not as responsive as usual, sleeping, comatose, those type of things are more serious, or trouble breathing. So we look for their alertness, their breathing, and whether or not they're vomiting and have a fever. Those 4 things are the classic ones.
Okay, now you mentioned vomiting, and I remember, as a child growing up, if we took something that we weren't supposed to eat, or drank something we weren't supposed to eat, they gave us, I think it's called Ipecac.
Ipecac,
yes.
yeah.
And so, to make us vomit, but I understand that it's not good.
No, it's not, and those guidelines have changed, so you can't even buy Ipecac anymore. But we don't try to induce vomiting in anybody anymore, because actually, when you ingest something, it's in there, and you really have to vomit almost immediately after to get it out. Plus the damage that's done from vomiting can be severe. You can aspirate, meaning breathe in the contents of your vomitus, or you could bring some of that toxin back up into the esophagus and make your situation worse. So we do not recommend induced vomiting anymore. If there's something in there, like let's say a child swallows a whole bunch of pills by accident, then when you take that one, you have to go to the hospital for that, okay? You can't do that at home. But if your child, let's say, swallowed half a bottle of Tylenol, you would go to the hospital and they would put a tube down through the throat into the stomach and suction it all out. Oh. So that's a safe way of getting it out.
Okay. Now, is it true that if a cleaning product is accidentally consumed, that you should drink a glass of milk?
Yeah, you should probably, the recommendations are drink a glass of milk or water. Milk, because it tends to be a soothing thing, and it's also going to neutralize some of the toxins if they happen to be there. Water is fine as a flush. So either way, if you accidentally do that, you drink a little glass of water, and then you proceed to calling the Poison Control Center. One more time, 1-800-222-1222.
Is there a poison center here on Guam?
No, there isn't. We use the National Poison Control Center, and that's for the whole nation 24/7.
Oh, okay. Now, we talked about ingesting, bleach or household detergents, but what do you do if it splashes in your eyes? Because sometimes when you're pouring,
that can happen.
Can
so
splash.
First thing is prevention, right? things splashing in your eye, it's a terrible thing. Wear goggles or glasses when you're doing cleaning. The other thing is frying pans, you know, cover it, be careful that doesn't splash in your eye. But if you did have a chemical splash in your eye, then go immediately to a tap and start flushing it with water. The length of time flushing is really important. You need 15 minutes, so take a look at your watch and then start flushing for 15 minutes. Room temperature water is fine. It doesn't have to be hot or cold. It just is the volume of water that you need to flush it. Some places have an eye rinse station where it's actually like a water fountain going up into your eye. But any tap will do, just the continuous flushing is really important.
Oh, okay. Now, is there a certain time where, you know, if you do get something in your eyes, you should actually go to the doctor? Like, what symptoms should we look out for?
Well, obviously, if there's severe pain, the pain comes from corneal irritation. That's the piece of your eye that's right in front of your pupil. If you can't see, if there's a haze, so pain and visual problem, you really need to go get seen. Usually, if it's a small amount of the substance and you flush it out after 15 minutes and you blink your eye, you're okay. You can tell something happened, but you're not in pain. If you're in pain or you can't see, you got to go to get checked.
All right, thank you.
You're welcome.
So when we return, we're going to answer some of our viewers' questions, so don't go anywhere because we're just getting started.